When things go wrong, as they sometimes will, when the road you're trudging seems all uphill, when the funds are low and the debts are high, and you want to smile but you have to sigh, when care is pressing you down a bit, rest if you must, but do not ever quit. Success is a failure turned inside out. Let's talk and clear the clouds of doubt.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to a new episode of Let's Talk. I'm your host, Khalil Amunet, and today we're going to be talking about cupping, an issue or a thing that is actually quite popular now and is spreading across the world, but maybe some people have little information about. Here to talk to us about that is Dr. Munir Ravalia, chairperson of the International Cupping Society. Assalamu alaikum.
Wa alaikum salam, brother.
And of course joining us is our in-studio audience. Assalamu alaikum.
Wa alaikum salam.
And for this part of the show, we're going to turn the show to the doctor, and he will explain briefly about cupping.
Bismillah ar-Rahman ar-Rahim. Cupping in Arabic is known as hijama. Maybe if we define cupping, if we change that name to wet cupping. And the difference between wet cupping and traditional dry cupping is the actual extraction or removal of blood from the body.
Okay.
The reason why we would want to do this, because there are certain stagnation areas within the body that the blood collects in. And it's been sort of shown through medical studies that removal of this blood is very beneficial to all the whole body system. And if I explain it very simply for the audience, like we take our car for the general service every year, and the mechanic, he will drain the old oil and replenish it with the fresh oil. So this new oil, it replenishes the engine, makes the car work better, more efficiently. The same way for the body. By removing this old, so-called bad blood, the body has to reproduce fresh blood, and this replenishes the organs. And 70% of disease comes from within the blood. So if you're actually removing the old and replenishing with the new, it's a very good way of the body keeping itself in check, detoxifying itself, and also for specific medical ailments, it is utilized for this. For example, people who suffer from chronic conditions, it's very, very beneficial. Over and above maybe the medications that we are used to taking throughout the world, not only in the West, in the East, we become very addicted somewhat to medications.
To medication.
Yeah.
So wet cupping, specifically removing the wet, refers to blood?
Exactly.
Okay, so what is involved? What kind of instruments do you use for cupping?
Okay. Obviously we wish to promote this as a very safe practice. Not maybe some people may have seen videos on YouTube with blood squirting out everywhere and dirty cups. What we use we use sterile equipment, and all our equipment should be disposable. To safeguard the patient, this is the utmost. And especially in Islamic medicine, there's no point a physician or a doctor trying to do some medical treatment but harming the patient at the same time. But also by using sterile equipment and disposable equipment, it also safeguards the practitioner. So the doctor needs to safeguard himself first and foremost.
His practice from
Exactly.
lawsuits and other things.
These things will come in, yes.
Okay, so can you explain just the process of how it works, specifically bad blood? Is there any sort of research on this topic of bad blood, for example?
Yeah, there are more and more studies coming about. And inshallah, I think later on, Dr. Tamir, who is a specialist in the hijama, he will be going to very specific clinical details. He has done a thesis in respiratory medicine for children on how the cupping actually medically produces benefits for the patient.
Okay, so are there any complications from cupping, or is there any problems that can be raised from cupping?
Sure, if you look at the procedure, there would be maybe something that you might term as a short-term, not necessarily complication, but sometimes, for example, certain places of the body for treatment. For example, on the face is very good for ocular problems, eye problems, on the head. But this will leave us a period of bruising for a certain period of time.
Okay.
So obviously the patient needs to be aware of this because they may be going to work the next day, and people, may not appreciate what this is.
Yeah, so how long does this, bruising, or because I've seen some pictures online while I search cupping.
Yeah.
There does seem to be some sort of round circle bruise.
Exactly.
What is that?
I mean, this is when you are drawing the blood to the surface of the skin. You get a local congestion. Different between different skin types. Also, the color of the person's skin will affect the type of bruising. But as I say, this is not really complication. It's just a period of time that the patient will experience this. But eventually, this will go away, fade away.
And it's, temporary.
Yeah.
Okay, so like you mentioned earlier, fire cupping. The Chinese also use different kinds of herbs, and there's dry cupping. What are the different kinds of these? And I guess the Islamic version, hijama, is only wet cupping.
Yeah, that's correct. I mean, traditionally the Chinese would use the method of creating the vacuum, because the actual cup is placed on the specific point of the body that you're treating, and the fire was traditionally used to create the suction, to create the vacuum. So that's what would be known as the fire cupping. But these days it's very simple. We have a hand pump that creates that vacuum, so maybe some of the dangers that may arise with the fire cupping is removed. There is some benefit though in using the fire cupping, is because the heat causes something called vasodilation. It actually draws more blood to the area. So there is benefits with different techniques. And as you mentioned, that the Prophet ﷺ, he utilized the wet cupping, and in the hadith that talks about this is in Sahih Bukhari. He talks about benefit from three things: from the gulp of the honey, from the incision of the cuppa, and from cauterization. But he also mentions at the end of the hadith that it's forbidden. The akhir dawa, the last of the medicine, is from the cauterization, and that is a technique of sort of using heat and burning the area.
But some would say, okay, well, the Prophet lived a few 1,000 years ago, roughly. That was sort of like antiquated medicine. What is your view on people who say that?
Sure. As we know, the Prophet ﷺ, huwa rahmatan lil alameen, he was sent as a mercy unto mankind. So this was from the time that he was up till the end of the world. So people who say that, I can maybe understand. They're thinking maybe in the old days they use these old techniques and there's no evidence for it. But this is something that we're actively doing within our society, is to have a program whereby specific medical studies are conducted to show the benefit from this. And as I say, the reason why hijama works so well is because it's a technique and a method that allows the body to heal itself, rather than using other things like drugs, which as we know have side effects. For example, even a paracetamol, something very simple, something that we may even say, okay, it's very cheap to use.
Yes.
You can just take a quick paracetamol, might get rid of your headache. But these things they do have side effects. And even something like a paracetamol, it takes 1 week for it to be cleaned from the whole body system. So these are some of the specific reasons why we are promoting and trying to revive this sunnah.
But I mean, you said, but also hijama has, you get temporary bruising, for example.
Sure.
So are you saying the damage to these painkillers, is it just temporary or is it long-lasting?
Long-lasting. And if you actually look at the pharmaceutical companies, they even create diseases so there is a drug for it. Because they spend billions on drugs. So if they've spent X billion on a drug, but there is no disease for it to cure, they create these things, which is unbeneficial to the whole of the society.
Okay, thank you for that. That's all the time we have for this segment. We're going to go to a short break, and we will be back with more. Thank you, and stay tuned.
Closing the Gap.
Why closing the gap?
In this program, Sheikh Yusuf Estes and Omar Dunlap are going to discuss how to bridge the gap between peoples of different cultures and orientations, the gap between males and females, Muslims and non-Muslims, the East and the West.
Human beings feel like that they're being slighted one way or the other. The gap between the youth and the elders, the gap between various status in working, the work field, and education, and then trying to provide solutions for these particular problems.
Assalamu alaikum. Welcome back. Thank you for staying with us. We're sitting here talking with Dr. Munir Orvalia about cupping. And we're going to now go to our audience to see if they have any questions.
Assalamu alaikum. I have a question. My mother, she has a CKD, chronic kidney disease, also has a high blood pressure. She's not allowed to use any salt. And because of this disease, she gets swollen legs and arms. So she bought this cupping set, but she's not sure if she should use it. She's scared of it, basically. So is it good for her to use it? Would you recommend it?
What I would say, first of all, she needs to have an assessment by ideally a doctor, but also someone who's trained in the wet cupping and hijama. There's no reason for her to be scared of the treatment. It's fairly easy. There are light scratches to the body, and everyone would react differently to that. We can expect that. But for something like her, she has a chronic condition, so it's not that just necessarily you do the hijama once and she'll be cured. It may be a series. After she has an assessment, the doctor will draw a treatment plan and then decide for her, okay, she needs regular treatment after a certain number of weeks for a period of time. But for example, you mentioned for the blood pressure, if I give a very simple example, if you have a can of Coke, when you release that pressure, it reduces the pressure. So the same way for the body, when you remove the blood, you remove the volume of that blood. If you think of the body as the can, you're actually reducing the pressure. So that physiologically is actually reducing her blood pressure. So hence she could possibly end up reducing her medication that way.
Yeah, and her kidneys, they don't work well, so she doesn't urinate enough.
Yeah.
So would this help, like the cupping, would that help her,
yeah.
her urination?
As if we can mention again the hadith of the Prophet ﷺ, he said within the honey, the cupping and the cauterization is a cure. So this is from Sahih Hadith in Sahih Bukhari. So we understand there is a cure from this, but the timing we don't know. This is only from Allah subhanahu wa ta'ala. So some people may have treatment after one time and they get benefit. Some people may be treated for 10 years maybe with this. But if they keep the yaqeen and understanding that this is from the sunnah and recommended, then obviously the cure is only from Allah subhanahu wa ta'ala. It's not from us, anything that we do. So inshallah we pray that she gets shifa from this.
Thank you very much.
Shouldn't these treatments, shouldn't they be used also, shouldn't they seek medical help from like conventional medicine? And then if they want additional treatment, they should go to something like that's more natural, for example. But shouldn't they go, like if you have a high blood pressure problem, shouldn't you go to a doctor first who's specialized in conventional medicine?
Yeah, I mean, I think ideally someone who's trained in what we call conventional medicine,
yes,
and someone who knows about this traditional medicine or complementary therapy would be the most ideal person to visit. Because it's not to say that within the modern science or modern treatments is to push that all aside. We're not saying that at all. It's to complement and utilize and gain the best from both sides.
Okay, do we have any other questions from the audience?
Assalamu alaikum. My question about cupping is, say for example a patient complains about pain in like a leg area, like does that mean there's bad blood in that area and the cupping takes place in that area, or could say the blood move throughout the bloodstream and it's hard to find the area of problem?
Usually pain, I mean, dependent on what the cause of the pain was. So for example, if they've had an injury or something like that, it's very site specific. So pain is treated specifically at the site of the pain they are feeling. But you're quite correct in, for example, someone might have something called referred pain. So maybe if I give you a very simple example, someone might have pain in the tooth up here, but the actual problem is down here because all the nerves are interconnected. So it's something called referred pain. Hence, once they have an assessment by their doctor or the hijama therapist, they can see, okay, what the cause of this problem is. Because someone may have arthritis. So this would be the pain would be from something, a chronic inflammatory disease, and they would need specific treatment within those specific areas.
Is cupping considered, is it Islamic necessarily to practice cupping?
I would say if we look purely from the hadith again, that it's not only something to be used specifically if some people, quite rightly maybe they don't have the full knowledge, is that they think, okay, you have to be on your deathbed or have something very serious to have the cupping done.
Yeah.
But we know that the Prophet, peace be upon him, He recommended even before the summer months that someone should have cupping. So it's a form of detoxification, because especially in the lives we lead today, all the car pollution, the food we eat, the pesticides, all these things can get contained within the blood. And as we mentioned before, 70% of a disease comes from the blood. So by removing that, your body refreshes and replenishes itself.
So it's like cupping can be used for spiritual ailments, for example. Is that possible?
Yeah, I mean, there are many times that we use the hijama, or the wet cupping, for those people who have been afflicted, maybe with jinn, people who have psychological problems, depression, bipolar disease, schizophrenia. The hijama is very, very good in these cases, as we know, with a combination of ruqya as well, that an individual can do, the utilization of the Quran. But again, it depends from the initial assessment, because there may be those people who have psychological problems that may need some form of medical treatment. So it's not to dismiss those, but it's very important that
can use
the individual who is assessing is able to differentiate and put the patient into the right category, so they get the best treatment.
So do you consider like cupping like a cure-all? Because I mean, all the diseases, they said yes, cupping can cure them. Is there any diseases you can't cure with cupping, and not necessarily diseases but ailments?
Yeah, I mean, obviously something, for example, like a cancer, if it has spread, if there's malignancy, so if someone's got a chest cancer and it's gone to other parts of the body, it's quite a widespread. So it may not necessarily cure, but again, as we say, the cure is only from Allah. We cannot make that judgment. But it may be a way of assisting the patient to have the quality of life will be improved and reduce the symptoms they are facing.
Okay. Do we have any questions from the audience?
Yeah. Assalamu alaikum.
Alaikum.
My question is like, where did cupping like originate from? Like, who invented it?
Right. There is a lot of history regarding cupping, and it's been practiced for thousands of years. Even the Egyptians, ancient Egyptians, on some of their scriptures, they have, you can see the cupping instruments. And there's something called the Ebers papyrus. We know the papyrus from Egypt, and it was utilized from them. The Chinese have also been using this. The Greeks have been using it. So there's a long history. It's not that something has just suddenly sort of sprung about. There's a very long history of this that has been used for ancient times and benefit people. And we see now, alhamdulillah, the sunnah is being revived again today.
So the major point here is that it's not invasive, it doesn't affect it's outside of the body, and it heals quickly. So what do you say? Some people say like cupping must be practiced in certain days, like the full moon or some certain days. Do you have any research about that?
According, again, if we look initially probably from an Islamic point of view, of the Prophet ﷺ, he mentioned that the cupping should be done on the 17th, 19th and 21st of the lunar month, so the Islamic calendar. And from that there's a cure. But also it's not to say that necessarily hijama or wet cupping is forbidden on any day. It can actually be conducted on any day of the week and at any time. But again, there are specific times, as we mentioned, in the month for it to be done, and specific times in the day. Early morning, before one has had their breakfast, this is actually the optimum ideal time to conduct the hijama treatment.
So when I was thinking about a full moon, for example, like in the news you hear, the crime rate during a full moon goes up.
Yeah.
What is maybe the reason why? Because of the tension from the moon, the full moon, or is there any kind of research into that?
There is some studies conducted into that, and these talk about the way the full moon, the moon, it pulls the tide of the sea, and at this time it's when they call the blood is raging, the blood is boiling.
Yeah.
So this specific period that's why, hence where you maybe say people are out committing crimes and things like that.
Yeah, there's a lot of tension. You feel tense yourself.
Yeah, so on those specific times when the blood is very hot, extraction of that blood at that time, it calms the body down, refreshes you, and you feel very energized after that treatment as well.
So is it like, instead of like massage, is it like for tension, just like you feel personal tension, hijama can be used for that, or just like in everyday personal life, is it useful for that?
It's very, 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 very useful for that. And we have many patients coming to us, and alhamdulillah, not only Muslim patients, even in the West, we are seeing non-Muslim patients coming forward to this treatment because they have learnt about the benefits of this. And again, they are tired of going to their doctor. They have a pain, they have an ache, they have an ailment, and all the doctor does is prescribe them drugs.
Yeah, yeah.
They're on a plethora, many medications that are giving them side effects. So they are looking for those treatments, not only hijab, but maybe herbal medication as well, but something where their body can refresh and replenish and heal itself.
So how many people around the world are using cupping, like right now in the modern age?
I mean, I would say from my experience, alhamdulillah, I've been able to practice hijama for the last 6 years. And within the last 2 years, I've seen a great increase in this. I think it's practiced a lot in the East and the West, but because of there's no real government regulations, a lot of treatments are done sort of what they call hidden treatments. So not in the limelight. Someone might not have a big clinic to practice it in, but people are benefiting from this. And obviously, if you personally benefit from it, then you will advise your friends, your family, your children to gain from this.
But I mean, you understand why that's a problem. Like, okay, it's not government regulated. You don't really hear about it much. Like, honestly, that's cupping is something I've heard about, like people do, but not necessarily in the modern age. So maybe it has like, it needs more regulation, more oversight, research.
Yeah, no, I totally agree. I mean, especially to convince people's minds, especially the doctors who are practicing conventional medicine, for them to see and understand the benefits, they would like to see specific clinical trials.
Yeah.
And one of the reasons we started the International Cupping Society was to have some form of regulation of this. Just like when medicine or allied health professionals like dentistry, nursing, when they started in their individual countries, they became self-regulatory. So they had a body that regulated to safeguard the patient and safeguard the clinician. In the same way, we would like to emulate that. And this is what we're trying to work towards, inshallah.
Okay, do we have any more questions from the audience?
Do we have a specific age that we can't use cupping words? I mean, for babies, kids, children.
Yeah.
Can we use cupping?
Yeah, I would say obviously for someone to be treating very young children or very old people, they need to be quite experienced in the hijama. But it's not forbidden to do it on any of these age. And even in Turkey, I know a doctor there, that they utilize cupping, a very small cup, and a very small amount of blood is removed after the child has been born if the mother has had a cesarean section. And again, it can be used for very old people, but with specific precautions.
We have no more questions?
Assalamu alaikum. I have one more question. Cupping, are there any specific places on the body which is like not recommended to use cupping on? Because I've heard it's not good for cupping your head on your face and stuff.
No, we actually see that cupping on the face, as we mentioned earlier, is very good for eye diseases, people with chronic sinus problems, and utilization on the head, again for those who are suffering from depression, anxiety. It actually can be used for increasing your memory. So we see students of learning doing the hifz of Quran. It's very good for this. Actually, treatment on the head is very, very beneficial as long as it's conducted by an individual that is skilled and proficient in this area.
Okay, thank you very much.
So, obviously cupping is used nowadays and it was used in the old days. How has cupping changed? Is it even the same treatment? Because you said, of course, the suction cup, that we would know there's nothing like that in the Prophet's time. How has the treatment changed since the Prophet's
I would
age?
say maybe advancement in in actual physical equipment and techniques.
The physical equipment.
Yeah, so for example, they may have used the fire, a bullhorn, but now it's very easy for us to get one of these pumps. You can even get electric devices to assist. So I would say it was changed in that way. But the actual, the specific, the way the treatment is done, there is no difference in it. It's actually extraction of the blood. But the way the points, some people might say, well, how do you know which point is which?
Yeah.
This is something known as observational medicine. So for example, an individual, a patient comes to him and he's treated him on certain sites of the body, and they've noticed that the patient has gained benefit from this. So over time they will treat the patient on these different areas, because we may not find a hadith about every single disease in the world. This would be impossible.
Yeah.
So over time, those who have been practicing this traditional art would have worked out a way, like the Chinese, they have body meridians. So these are channels running through the body, and we know that these are very similar to the specific sites that we use in cupping.
Okay, like what are the dangerous though methods of cupping? Is there any dangerous methods? Like when I was looking it up on the internet, like there were some burns. They had been burned because people had done cupping, but I think the person wasn't an expert or something like that.
Yeah, I mean, obviously, for anyone to be practicing any medicine on any patient, they should be very proficient in this. Burns can occur, for example, if the cup is left on too long and it's too strong a vacuum. This can cause a temporary burn to the area, and that would take an increased period of time of healing, and may even leave some slight scarring in the area. So again, an advice to anyone going for this treatment is to go to an individual that is very proficient and experienced in the hijama. Yeah.
Okay, inshallah, we're going to go for a break, and we'll be right back. Don't go away.
Back to the Prophet. Join Sheikh Omar in the program Back to the Prophet, wherein he teaches us practical lessons from the Prophet's life and how this can help us to overcome our challenges in the present.
We talk about the life example of the Prophet Muhammad, peace and blessings be upon him, seeking guidance for ourselves. In the early days after the revelation of the Holy Quran, the Muslims were greatly persecuted, so much so that quite a few Muslims had to leave Arabia and migrate to Africa to live among Ahl Kitab, Christian people who followed the gospel of Christ.
Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you for staying with us. Joining us in the studio to talk about cupping is Dr. Tamer Sha'ban. He is a medical doctor and a researcher at the University of Cairo, and he's also the vice chair of the International Cupping Society. Assalamu alaikum wa rahmatullah.
Alaikum salam wa rahmatullahi wa barakatuh.
And the first question I want to ask you is, what is the history behind cupping?
Cupping therapy is dated back from thousands of years. The first do cupping is the ancient Egyptians. The first book written in medicine, Eber's Papers, is the first book who mentioned cupping. Cupping, there is we have a slide there. There is a tomb with cupping glasses in front of this tomb. Then ancient Egyptians passed this modality to Greeks. Chinese take this modality and they practice this, then get all over the world. There is then when Rasulullah sallallahu alaihi wasallam come and do cupping therapy and tell us to do cupping therapy, this survives this ancient method of healing.
Okay, what is the evidence behind cupping exactly?
Yes, cupping, there is a new science, is evidence-based medicine. This evidence-based medicine, we make trial about something we can't see. Yes. We can't know its mechanism and see the results. When we see good results, this is evidence for this modality. Cupping, there is many researches about cupping therapy. In Egypt, as example, there is a doctoral thesis about the effect of cupping therapy for diabetes and for rheumatoid arthritis, and they get a very good results in this trial. There is another study about cupping therapy for lower back pain. This is give very good results.
And I understand you also have your own research paper about asthmatic children and the benefits of cupping for them.
This study is about the role of cupping therapy as a complementary medicine for on the pulmonary functions and the quality of life of asthmatic children. I do cupping therapy for 30 children as a treatment group, and there is another 30 children as a control group who take only drugs. My treatment group take cupping therapy and drugs.
And drugs. Okay.
And in the final of the study, we find that there is significant results, positive results from cupping on other group. My group, which I treated with cupping, get a high quality of life. They go to their schools regularly. They don't have any acute attacks during this study. They get higher pulmonary functions than other group.
So that's exactly what the difference is. So what were the specific differences as a whole for the different groups? Like how did the ones who use cupping, how did they benefit more from the?
In this study, I think about design a program for every family. Asthma is very, very, very bad disease.
Yeah.
And when the asthma is in the child, prevent him from playing, from going to school. And in my intent, I intend to design a program which we can teach this method for a father or a mother. This method which I used is a flash cupping therapy. We can very quick applying and removing of cups on certain points. When father or mother can easily learn this procedure and do this for her or his children, this will be very beneficial for them. When I start this study, I actually afraid from not participating from mothers and fathers for this
maybe
study.
they'd be too scared or something.
Yes. After one session, they ask for me to do the whole course of cupping. The course is 10 sessions, 2 per week, for 5 weeks. After from the first week, they see the difference on the child.
Okay. I also have a question for you, Dr. Munir. The mechanisms of cupping. We also have a slide about this, and you can both add things to it. The mechanisms of cupping.
In terms of the
actual, like you spoke about flash cupping. What are the different mechanisms throughout history also?
The mechanisms of cupping therapy, there is different series about cupping therapy. There is many studies to show what actually the mechanism of cupping therapy. One of them is the Bain Gate theory. There is a series that said there is a pain channels in the body.
Yeah.
Transmit signals from the painful area to the brain. Cupping will prevent these signals from reaching the brain, then the pain go away. The next is prostaglandins theory. Prostaglandins theory is are products of inflammation in the body. When we take these products outside the body, the inflammation will cure. Other series, there is more acceptable series, nitric oxide theory. Nitric oxide is a gas which produced in the body by the wall of the arteries and veins. This nitric oxide cause vasodilation of the body, increase the circulation, prevent thrombosis of the blood. Some studies showed that when we do cupping, this gas released in the body. Another theory is endorphin and enkephalin theory. Endorphin and enkephalin are physiological pleasure substances which produced from our brains. These substances, there is a theory that the brain produces these substances after cupping, and this will
so
make
it
us
releases these certain chemicals
and
in
this
your body.
is what we feel after cupping. We are happy and we are
Revived,
in good.
renewed.
Yes. The Chinese medicine theory is the channels, energy channels theory. There is a 14 channel in the body, all over the body. This channel have each points in every channel, and by stimulation certain points we produce some effects, such as acupuncture theory. There is a very popular research published in the Journal of Biomechanics in 2005 by the researcher Sam. He said that cupping can stimulate acupuncture points, and any acupuncture, any evidence that proves that acupuncture can cure anything or can treat any disease, this apply to cupping. And he replied to some of of USA societies, such as Cancer Society, said that cupping have no evidence, but acupuncture has evidence. He replied to this word by this research. Cupping can stimulate more than acupuncture in any disease.
Okay, there is a hadith, Dr. Munir, that says you can't do cupping on certain days. Do you know anything about this? What is your opinion on that?
Yeah, in Ibn Qayyim al-Jawzi, in Tibb al-Nabwi, the medicine of the Prophet ﷺ, he mentions in the Arabic these various hadiths, many relating to the hijab and cupping, and he also gives the tafsir of these hadiths. Unfortunately, in the English translation, they've left out some very important points. So the one that mentions specifically about it is forbidden to do on this specifically mentions Wednesday and Friday, that these are actually weak hadith. And he even mentions that the one who had narrated the hadith, huwa kadhib, he was actually a liar of this in translation of hadith. So we need to be very careful of this, because unfortunately, because of this miscommunication from the translation, many people are staying away from hijama for Wednesday. But as we mentioned earlier on, that hijama ideally, to get the best benefit, can be done on the 17th, 19th and 21st of the lunar month. Inevitably, there will be days where a Wednesday and Friday fall on these. So these are not contradicting each other. It's rather there's a weak hadith. And even Allah subhanahu wa ta'ala, that He created on Yawm al-Arba, on the Wednesday, He created light. So again, this is the reason we do this. And Imam Malik, he also had hijama done on these specific days himself, to show people that it's not forbidden to do hijama, can be done on any day of the week.
Because there's good in it, so why would it be said that you can't do it on a certain day? What are the types of cupping? There are different categories.
Okay. Many people know that cupping have only 2 types. But actually, there is 11 types of cupping therapy. The first is according to the pressure applied to the cups, light cupping therapy, medium cupping therapy, strong cupping therapy. There is a massage cupping therapy. There is also needle cupping therapy. They apply needle before applying cups. There is a herbal cupping therapy. Put some types of Chinese herbs before applying cups, because cups increase circulation in this area, and this can get more enhanced actions for these herbs.
The herbs circulate in the blood?
Yes,
Okay.
yes.
Okay, so can you just explain, like, you said, like, specifically, like, the types of small, like you said, what does that involve, the weaker cupping?
Weak cupping therapy is for children and for old people. We can use weak cupping therapy and medium cupping therapy. There is a special cups for that for children. Rubber cups, self-squeezed cups, and when we do cupping with these cups, there is a medium or a weak suction produced. Strong cupping is for adult people for some pains. Massage cupping therapy to treat large areas, to treat muscle spasms. Needle cupping therapy used in some cases which when we need to stimulate certain points and stimulate the around area. In some research, we don't need to put needles in, we put the cups because we just by applying the cups we stimulate these points actually, and the needle is very small to apply, but the cup is large, then stimulate this point and the point around it.
So Dr. Tamer, what for a person who has no ailment, he just wants to try out cupping just because it's a tradition of the Prophet, what do you recommend for him to do? What kind of cupping?
Cupping as a treatment can be used as a treatment and can be used as a preventive from diseases. We can do cupping for preventive medicine. I recommend go to a good cupping therapist. Recommend choose the best days from Sunnah, as we say 17th and 19th. Choose the right time to go is the early morning to go to have a good cupping session for preventive.
Was that because before a meal or after a meal?
We recommend who will go to cupping not to eat 2 hours before cupping session.
Oh, okay.
Yes.
So what's the reason for that, not to eat?
Because some afraid from this, we can vomit or can...
Oh, okay. Yes. So is there any pain that involves cupping, like when it's... because you said you might vomit or anything. Is there any pain that you get from it?
No, I mean, the incisions are very small, and when you apply the cup to the area with a vacuum, it actually creates something called a partial anesthesia. So it sort of numbs the area. But obviously different areas of the body, some areas are more sensitive than the other, and the patient may feel these little scratches. So that is something to, again, the patient, for them to be aware of there. But in the light of things, if you think of the benefit that you're going to gain, they say sometimes in the West we say no pain, no gain.
Yes.
So it's a very small amount, light scratches, like paper cuts, and then to gain the benefit from that.
This is a small surgery.
Yeah, it's
Any
not
surgery you must fast for.
Yes. Okay, that's all the time we have for this segment. We'll be back after a short commercial break. I hope to see you guys back.
Love Allah subhanahu wa ta'ala, for those who worship Allah subhanahu wa ta'ala alone, for those who want to enter the Jannah, the paradise that Allah subhanahu wa ta'ala created for the believers. And that's why we need to learn and we need to get to know what Allah subhanahu wa ta'ala wants from us, so that we submit ourselves to the orders of Allah. And this is knowledge that we need to learn. Why we're spending more time to look into the verses and to the meanings of the verses in depth, so that we can get to learn from it what we need ourselves to be steadfast, to be obedient to Allah subhanahu wa ta'ala, to ponder over the meanings of the miraculous words of Allah subhanahu wa ta'ala.
Assalamu alaikum. Thank you for staying with us. We're sitting here with Dr. Munir and Dr. Tamer discussing cupping. Dr. Munir, there's been, I think, some cases of people experiencing nausea or fainting during cupping. What is the reason for this?
There are several reasons for this. The first reason may be if someone is scared of the sight of blood, or the actual thinking of the incisions, then the body naturally, to defend itself, may react in this way. The other reason, specifically physiologically, meaning the way the body works, is because you are removing blood, it's a shock to the system.
Yeah.
So the body is generally not, especially for males, it's not used to losing even a small amount of blood over a short period of time. So as we mentioned earlier, the blood pressure, when you remove the blood, will drop. So the heart, it needs to pump harder, and there's not enough oxygen going to the brain.
Okay.
So this is the mechanism of fainting. For example, even if you're standing up, the
You
reason why
suddenly stand up after you've been sitting.
Exactly. So that's called postural hypertension, because your blood pressure suddenly dropped very low. Yes. The brain needs oxygen. It's not getting enough, so your body, to protect itself naturally, you sort of fall sideways, so it's easier for the heart to pump that blood to the brain. This is nothing to worry about, but it's something, again, and I'll stress this again, is go to an individual who knows what they're doing, because it's very easy to manage. The patient can either be laid down, or ideally, if you're having the hijama done, especially for the first time, you can actually have the patient lying down.
Okay.
And after that, even if they still feel nauseous, it can be also because they haven't eaten for a while, so the body has a low glucose, they're feeling a bit weak. So ideally, we have a cup of warm water and honey, because like we mentioned, the hadith mentions the honey as well.
Okay, so
we
you
try and utilize
different.
The other prophetic medicines, the habba sauda, the black seed oil, the vinegar, olive oil. Try and utilize all these with the wet cupping of the hijama.
Okay, Dr. Tamer, there are different kinds of cupping sets, different cupping sizes, for example.
Yes.
Can you speak to it?
There are many different kind of cupping sets. Cupping is the plastic cupping set, which contain a gun to create vacuum, and 6 or more cups of various sizes. There is a new cupping set today in the market, a facial cupping set. This is with a syringe-like vacuum apparatus. This to create vacuum, and very small cups to do facial cup. In America, there is a stand-alone therapy, is facial cupping therapy. This to remove scars from the face. By massage cupping. I see many pictures about this therapy. I don't practice this type of cupping therapy, but I see very good result to remove scars without any surgery or any operations. There is a main cupping therapy set. This therapy set to treat impotence in males. There is a woman cupping therapy set used to enlarge the breasts. There is a cupping therapy massage. This for slimming purposes. There is a big machines used in beauty centers because cupping can remove cellulite.
But is there a lot of research? You mentioned a lot of cosmetic things.
Yes.
There's proven results for these things.
Yes, as I told you before, there is an evidence-based medicine. When we see results of modality, this proves this modality. As electricity, we don't see electricity
or necessarily understand how it
but
works.
we see lamps and see its effect.
Okay, inshallah. We have any questions from the audience? Okay, go ahead.
My question about cupping is just the timing of it. For example, after the patient is done, is it almost like an instant feeling of satisfaction, or does it take a couple of weeks for the results of the cupping?
After patient doing cupping, according to his element, some patients feel very comfortable. Some patients with pains feel that this pain is gone away after doing cupping immediately. We recommend after doing cupping to rest for 1 or 2 days after doing cupping.
Any other questions from the audience? If not, I want to take a personal look at you guys as doctors. Dr. Munir, what made you decide to be a cupper? What made you decide to pursue this as a field?
Yeah, I was actually based in Egypt about 6 years ago, and some of my friends were going to have this cupping treatment. So they asked me to come along. I didn't really know too much about it, and I went along with them, and I had the treatment done. And the benefits that I felt were quite immense for me. So I thought there's something obviously in this, and I started to research a bit more. I started to understand the hadith about it. And alhamdulillah, after that I was able, the sheikh who actually did the treatment myself, I asked him if he was able to teach me. And he's actually the student of one of the main sheikh, his name is Sheikh Hefni, and he travels throughout the world teaching people and conducting this treatment. So we had a brother from the United States who actually had chronic depression, he had schizophrenia, and alhamdulillah, after he was on drugs for many years, since he was a child, and we put him on a treatment regime of having hijama done on his head every 2 weeks. And he now describes this, hijama is his drug. And if he doesn't have his drug, the hijama, he can fall back into the problems. And alhamdulillah, he's been able to reduce his medication. So from that, I realized the benefits for myself and from this patient, and it basically developed from that.
And Dr. Tamer, how did you come about to, when did you decide to learn and pursue this as a career?
From 10 years, my father have sciatica, low back pain and side pain. He go to doctors and they recommend operation for him. After that, he do cupping therapy, and he became very good after cupping therapy first session, but he need more sessions every month.
Yeah.
I need to help him. I started to learn cupping because of my father, and I do cupping for him. The first person to do cupping is my father.
Dr. Munir, do you have anything to say about the use of cupping for cosmetic reasons to change your natural appearance?
Yeah, I mean, this is something Dr. Tamer mentioned, but it's something that we don't practice ourselves. And obviously Islamically, unless there's a specific medical reason for doing it, it is not from within the Sunnah and the Sharia, so we advise people to try and keep away from this.
So you don't recommend it. Okay, inshallah, that's all of the time we have. I'd like to thank our guest, Dr. Munir Ravalia, also our guest, Dr. Tamer Shaban, and of course our studio audience. Thank you very much. And as a reminder, I'd like to tell you guys, you can contact us at talk.huda.tv. And we also on Facebook, so you can suggest different subjects or future titles of future episodes, inshallah. That's all the time we have. Thank you very much for viewing. Assalamu alaikum wa rahmatullahi wa barakatuh.
When things go wrong, as they sometimes will, when the road you're trudging seems all uphill, when things go wrong, as they sometimes will, when the road you're trudging seems all uphill, when the funds are low and the debts are high, and you want to smile but you have to sigh, when care is pressing you down a bit, rest if you must, but do not ever quit. Success is a failure turned inside out. Let's talk and clear the clouds of doubt. Success is a failure turned inside out. Let's talk and clear the